Good day, my fellow community pharmacists. I made this short video presentation for my master research especially for you. In 2018, we conducted a study to evaluate the extent and barrier of pharmaceutical care services by community pharmacists in Malaysia. We did a cross-sectional study through a questionnaire with 120 community pharmacies nationwide on the pharmaceutical care practice, the barrier, and type of pharmacy services. We also conducted a similar client study at 100 community pharmacies in Klang Valley to study the pharmacy response on treatment requests from a walk-in client. We have written 2 papers. One has just been published at the Q1 journal BMC Health Services Research. These are the findings. The first is a type of pharmacy service provided by community pharmacy in Malaysia other than treating minor illnesses, medication dispensing, and counseling. As expected, most community pharmacies were providing health screening, monitoring service for non-communicable diseases and advice in health supplement selection to the customers. More than half were also providing services such as patient medication review, weight management, and smoking cessation. Next, provision of pharmaceutical care by community pharmacy in Malaysia. We adopted the 5 practice principles of pharmaceutical care from American Pharmacy Association in our study, which are what I marked here from 1 to 5. For example, patient data collection, which consists of if the community pharmacy interview the patient and having access to the patient record. You can see that about less than a quarter of community pharmacy fulfill that practice principle. Second, medical information evaluation. We ask if a community pharmacy explain the illness to the patient, ensure medication safety, and document any pharmaceutical care issue identified. There's about less than 20% of that. Then third, formulating drug therapy plan. If the community pharmacy taking effort to identify, prevent, and rectify any drug-related problem, do they intervene it? Do they ensure the patient having the financial means to purchase the medications? And also if they intervene any issue on that, do they make a documentation on that? There's about less than 10% community pharmacies fulfilling their practice principle. For implementing the drug therapy plan, if the community pharmacy explain how the medication works, ensure the medication's availability, contact the doctor if needed, and any documentation, is about less than 5%. And fifth, monitoring and modifying the plan. If the community pharmacy have some sort of follow-up mechanism and keeping the patient record, again, there's about less than 20% of them. If we summarize this community pharmacy who practice or implement all the 5 practice principles, it's about less than 1%, or 4 out of 420 community pharmacy respond to our questionnaire. We also asked our community pharmacy what are the barriers for them to provide pharmaceutical care. Now, lack of dispensing separation was deemed by most community pharmacy as a barrier, where we have 84% of the community pharmacy agree and strongly agree with the rating of 5.2, from 1 strongly disagree to 6 strongly agree. So we get a rating of 5.2. Now, this was followed by a lack of government initiative to refer patients to community pharmacy to obtain their prescribed medication. For example, like United Kingdom, where they have the transfer of care, where they refer patients discharged from hospital to the community pharmacy for medication reconciliation, or Thailand, where the public will refer the community pharmacy for some reimbursement pharmacy services. The third was the strict enforcement of prescription medicines, which prevents supply of follow-up prescription medicine without a valid or complete prescription from the doctors, compared to other countries without dispensing separation. So do note that these 3 top perceived main barriers were under government or professional healthcare policy. Now, a few local studies have also concluded that many challenges faced by community pharmacy today will need government intervention to overcome, instead of solely action from our community pharmacy. Community pharmacy also reported low number of prescriptions received, which at the median of 20 prescriptions a year. There were 4 outliers from the 4 pharmacy, which one received 10,000, then 3,000, 2,000, 2,000 prescriptions a year. We also have 5% received no prescription at all at the last 12 months. This means that the community pharmacy were not given much opportunity to provide pharmaceutical care, as these patients was getting their medication mainly from clinic or hospital. As mentioned, we also conducted a simulated client study at 100 community pharmacy in Klang Valley. We created a scenario where a young man seek treatment from community pharmacy for his father dry cough, who is a 60 years old taxi driver, a smoker, who also has hypertension, diabetes, hyperlipidemia, and taking periodontal and other medication. These were the highlights from our study on the question asked by our community pharmacy. Only 38 asked who the medicine for, which means we have about 62 of the community pharmacy assume that the young man is the one that who need the medication for cough, but actually is for his father. 97% or almost all asking what are the cough symptoms such as dry cough or phlegm cough. And we have 25 asking if the patient have any medical condition such as hypertension, asthma. With 13 asked if they are patient on other medications. With that, we have 9 community pharmacy identified as a possible drug-related problem in this scenario. Now we know that the periodontal, which is ACI, is actually a medicine that common side effect is a dry cough that may warrant the discontinue of the medication. We also examined the appropriateness of the medication recommended. 98 of the community pharmacy recommended medications or other products for the dry cough. 2 refused to recommend anything for the patients. 10 community pharmacies have recommended something not indicated for cough, such as to increase the immune system or for allergy. 85 of them recommended something indicated for dry cough. With 3, we do not know what they have recommended because there's no labels and don't mention medicine name to our patients. And with 85 who have recommended the medicine or product for dry cough, 67 only was deemed to recommend something appropriate, which would not cause drowsiness because the actual patient was a taxi driver, wouldn't cause increase of the high blood pressure or also the glucose level for the patient. Okay, so that means that we have about 28 of the community pharmacy could have recommended something not so appropriate for our patient in this case. In terms of medication counseling, the highlights from study on counseling element provided by 98 community pharmacy who were recommended medication or product to the patients. 12 explain the possible cause of the dry cough to the patients. 13 provide name of the medicine to the patients. High number of community pharmacy provide information about the medicine doses and frequency, how much to take and how many times to take a day. However, none warn of the side effect and also provide any information of the storage informations. We 6 also provide non-pharmacological advices management such as drinking more water or if smoking, then stop smoking or reduce smoking. We also have 11 community pharmacies advise the patients to go back to see them again or to see the doctors if the symptom persists over a certain period. In terms of time spent in consultations, about 2/3 of the community pharmacy spend actually less than 1 minute giving consultation to the patient. With 1/3 is spent more than 1 minute by less than 4 minutes in providing consultations. In conclusion, we find that community pharmacies in Malaysia were not providing adequate pharmaceutical care by international standard in the following areas. First is gathering of the patient data and medical information. Second, identification, rectification of existing and prevention of possible drug-related problem. Third, comprehensive medication counseling, not having monitoring and follow-up mechanism, and lack of documentation if they done any of the pharmaceutical care services. This actually is a common scenario among developing countries in Southeast Asia. However, the practice of some of these areas were not dependent on government and professional healthcare policy, which were perceived as a main barrier by community pharmacies, especially when we talk about patients seeking self-medication from community pharmacists. So what we as community pharmacy can do to bring a more positive impact to the community pharmacy practice? First, I think we need to reintroduce the pharmaceutical care practice as our core pharmacy services, especially the 5 areas mentioned. We can start with something simple like using pharmacy mnemonics in gathering patient medical information. For example, WWHAM, who is the patient, what are the symptoms, how long have the symptoms been present, action taken, medication been taken. There are also others mnemonics that you can choose from. Just imagine if our community pharmacists have been using such mnemonics, I think we could have a better research finding. And third, to implement 5R in good dispensing practice guide, right patient, right medicine, right road, and right time. Lastly, I would like to thank those who have assisted me in this study. They are my supervisor, Prof. Dr. Chua, co-supervisor, Dr. Mameti, research assistant, Jason Lee, and many community pharmacists like you. Thank you for watching.